So welcome everybody for the second Health and Wellness Summit from Natural Awakenings of Northern New Jersey. Uh, we are grateful to some of our sponsors who are contributing to make this event possible uh, in collaboration with Valley Health Hospital and Dr. Pucci's Get Well Now, and two of our other sponsors, Leased, which is an application for social commerce, as well as Lawn Reminders, which is a venture to take care of your lawns. Having said that, I would welcome Dr. Pucci and Dr. Burke. Um, Dr. Pucci is a practices functional medicine in Bergen County. Dr. Burke is a cardiologist at Women's Health at Valley Health. And I will also introduce our host for the evening, Gilly, who is founder of Gilly Organics and is pretty well known in social circles of Bergen County. So Gilly, you can take it from here.
Sure. Thank you, everyone. I am Gillian Stolwart Garrett, also known as Gilly because it's easier, and also founder of Gilly's Organics, which is an organic skincare line found in Whole Foods and wellness centers across New York, New Jersey, and Connecticut. I'm thrilled to be here for the second Health and Wellness Symposium, again with these esteemed doctors, Dr. Pucci and Dr. Burke. We have a few questions for you, and we want the whole community to get involved and ask questions after. So the first topic, we want to start with a healthy person. What are some of the early symptoms and conditions that one should be looking out for with the onset of a heart condition? What type of tests and monitoring should one do? For example, a lipid panel, is that required? I guess we'll start with Dr. Pucci.
Oh, okay. Let me begin by just saying thank you for hosting this and thank you for inviting me on. I think this is an incredibly important subject matter. And Dr. Burke will, attest to it also, as in her background, is that, we often think of heart disease as a man's disease, and certainly it affects a lot of men, but it is equally affecting women. More than all cancers combined. And I think it's finally coming into light, and we're paying attention to it. It's going to affect 50%. 50% of the people are going to be affected by heart disease at one point in their life. That means that half the people on this call are going to be affected by cardiovascular disease at one point in their lives. So this is a really, really an important subject matter. And I think what's really most important is that we understand now that integration is the way to go, that we need to have an integrative approach to taking control, or at least trying to prevent, if not even reverse, cardiovascular disease. That means, besides the medications, is that we also need to have a lifestyle intervention with diet and exercise and sleep and relationships and so forth. What I want to say, that before I even get started, as the evening goes on, is that anything that I am presenting this evening is really for discussionary measures. So if I'm saying anything, I want to make sure that that any decisions that you make, you should discuss any changes with medications. You have to discuss that with your provider, with your cardiologist or your primary doctor, who's ever. If you're taking blood pressure medication, if you're taking statin medications, do not just arbitrarily just stop taking that because of anything that I am saying this evening. Okay, it is really important that you engage with your cardiologist and or your primary doctor for any changes that you're looking to make. So what I'm presenting is for information purposes. Okay, I just wanted to get that out there. I think that's really important, okay? So your question was what, Gilly?
The question was, what are some early symptoms and what someone should be looking for, that onset of an early sort of heart cardiac condition? Tests should be monitored.
Yeah, so Dr. Pucci, Dr. Burke, the point here is it's kind of silently starts growing in, like your lipids are on the wrong directions, your HDL goes in the
Well,
wrong
okay, yeah. So,
direction.
when we see people in my office, I mean, we always run a comprehensive blood work. That's the first thing. So all too often when people come into my office from other doctors, I see that their blood work is very limited. They don't run enough markers. So we usually send them back and we want to get a more comprehensive blood workup done. So some of the key factors is that, I'm not looking for heart disease specifically. Right? People are coming to me for a whole host of conditions, but there are definitely some markers that are really, really important. And cholesterol is not the marker or the emphasis I'm putting any energy into, right? But I'm certainly looking at their triglyceride levels. That's really important to me. I want to look at not just the LDLs, HDLs. I want to look at the ratio of those. What's really important is really the HDLs is more important to me than even the LDLs. I'm looking at markers, inflammatory markers such as ferritin. Ferritin is often seen when ferritin is low iron states, but ferritin when it's elevated is actually an acute reaction or acute reactant. It's inflammation of the body. The other two markers that I routinely run on blood tests is the high sensitivity CRP. It's a C-reactive protein. It's a marker of inflammation systemically, but it is a marker for inflammation in the cardiovascular system. And I also like to run homocysteine as another marker. Homocysteine is another inflammatory marker. It's often associated also, again, with elevations with inflammation in the cardiovascular system. And it's also inflammation in the neurological system. So those are key things that I run routinely in a blood test.
Great. And as the director of Heartcare for Women, Dr. Burke, would you have anything I would like you to add to that? And then another question to follow.
Well, yeah, thank you again for having me, and welcome everybody. And I agree with what Dr. Pucci said. I think that there's so much to be said. We could have a whole talk on what to do with that healthy person walking in who's looking for prevention and screening. I think the basics in terms of us in cardiology is we're going to be looking for those risk factors that we know have been historic risk factors for heart disease right off the bat, and they have to be known by patients so that they can bring them to the forefront. So you can be proactive if you know you have risk factors like smoking, high blood pressure, you know your cholesterol numbers have not been ideal in the past, you know that potentially your waist circumference is a little bit greater than it should be, greater than 35 for a woman and greater than 40 for a male. You know that you're not as active as you wish you could be. If you live a sedentary lifestyle as opposed to a physically active lifestyle. You've had sugar issues in the past, diabetes, or even pre-diabetes. And then, of course, your family history, that golden ticket that a lot of people forget about. So what happened with mom and dad? In cardiovascular disease, we consider family history in first-degree relatives. So any heart issues before 55 for a woman and 45 for a male. So you have to always consider this. It's a very big deal for us, these things, and it's only the patient that can bring them to us and to our attention. And again, it's being proactive and saying, oh, you know what, I do have a risk factor. I should probably get that looked into, and seeing what I could do about it. Because it's those patients that come in that don't know they have this know your numbers motto out there in terms of screening. So what is your blood pressure number? What is your BMI? What's your body mass index? How many minutes a week do you exercise? Do you hit those golden numbers of at least 20 to 30 minutes a day of physical activity? And if you know those about yourself, you're doing a great job. You're on top of it. But if you don't, you go to your doctor to try to figure out, how you can get into the know and be proactive.
Great. You just touched upon like the next 4 questions, which is great. The next question is, Dr. Burke, what are some of the common heart conditions for women that you're seeing in your practice each day?
So, cardiovascular disease, it's an umbrella term. So cardiovascular disease is thrown out there, and in our world, we consider it arterial sclerosis or atherosclerosis or hardening of the arteries. Whatever you say it is the same. So coronary artery disease is the buildup of plaque, which is fibrous material made out of lipids and inflammatory particles that builds up in your arteries and can cause blockage. I have pictures if anybody wants to see.
Yes, please.
To share my screen, that would kind of help us along a little bit. The idea of what is coronary disease. Let me see if I could bring this up for everybody. Oh, I'm disabled. The host has disabled.
Prajna, can you let her in to do that? I think you have to ask to share your screen and then. Okay, great. Now it looks like Dr. Burke, you're the host now and you can share your screen.
Okay, great. So are we seeing it?
Yes.
Okay, good. So here's the idea of coronary artery disease, just so we could get a pictorial, and it kind of helps people get a better understanding. This whole idea of inflammatory particles and fats in the lining of the blood vessels to the heart. So what does it cause? It can cause these blockages that can cause heart attacks. This is the classic picture of the angiogram when somebody comes in with that chest pain picture that we're always so afraid of. So this is the angiogram that ensues after this process has been going on. But the problem is this process doesn't start the day before that happens. This process is lifelong. It starts from birth, and our lifestyle and risk factors bring this to the forefront. They make this happen. About 80% of coronary disease is lifestyle, which is why this is so important to talk about. So again, heart attack is from a blockage, a complete blockage of blood flow. So you see that anything downstream of that blockage no longer gets blood and therefore no longer gets oxygen, and that heart muscle then is dying. So that's coronary artery disease and heart attack as we know it. There's a lot of causes of that. There's the blockage issue with plaque buildup. There's also hardening of the arteries, which is a common issue that occurs with hypertension or high blood pressure and obesity. And then there is something that's much more common in women called coronary microvascular disease, which is a hardening of the very small arteries. So think about those little tributaries off the big river, the little side rivers. So that's what our arteries turn into at the bottom of the heart. Those arteries can also harden.
And how come those harden for women more frequently?
That question is not answered.
Wow.
The thought is women do have smaller hearts. They do have smaller blood vessels that could have some contribution. That hypertension and high blood pressure in women, for example, is very common, and smoking to cause this issue first before real blockages in the main arteries. So that's one of the theories. There is some hormonal theories related to estrogen. So but it is something, this is something that can cause chest pain without blockages in the main arteries. So it's something we always are on the lookout for, especially in females.
Wow.
I won't go on and on because I could go on for the whole talk, but I just, those are the pictures I wanted to show right off the bat.
But this is important because we want to talk about how it's diagnosed. It answers one of the upcoming questions. So
our diagnostics in cardiology are many. We start off with the basics like the EKG, which is the first thing basically that anybody will get strolling into an emergency department with a complaint of chest pain. So that's the oldest and most reliable test that we still have today. The echocardiograms we do to look at the pump and the structure of the heart and the valves. We do stress testing when patients have complaints of symptoms of heart disease, like chest pain, of course, but so much more: shortness of breath, fatigue, pain between the shoulder blades. As I explain it to women, it's anything between the belly button and the earlobe. It can be anything. We've heard it all. And those are exercise treadmill tests. There's also nuclear stress test and stress echocardiogram. So there's different modalities of stress testing. There's CAT scans now that can look at the heart arteries and see how they're filling and look for blockage. There's the catheterization, which is the picture that I showed you. That's the procedure that is invasive. You don't want to go for that test unless you absolutely have to, usually after an abnormal stress test, or of course, if you go in with a heart attack. Calcium scoring is now a very proactive test that can look to see if you have plaque buildup in the heart arteries when you're in the prevention mode. And those are the few tests we have just right off the bat.
That was very thorough. Thank you so much. What is it? How do you do that last one, that last test?
The plaque score or
The
the
plaque.
calcium score?
Yeah,
That's a CAT scan. CAT
CAT
scan,
scan.
no dye.
Okay, great. Because that was so thorough, I'm going to ask the next question to Dr. Pucci. Maybe we'll unshare the screen now.
Sure.
Thank you so much for that. Dr. Pucci, do you see the COVID lifestyle increasing or decreasing the risk for cardiovascular issues?
The COVID lifestyle?
I don't know, that's the question Dr. Anil gave me, but I think what he means here is the way that COVID is affecting the world right now. I imagine that depends on the person, right, Anil?
Are you asking?
If the person.
So what has happened is with COVID coming in, our lifestyle has changed. We are probably like some people are less active because they don't have to go to work these days. Everybody's working from home. The gyms are closed. So some people have started doing like a video thing and all that. But not everybody has adapted to that part, right? We are eating slightly differently. We are sleeping, like people are getting better sleeps. So there are some different variants that have come into our lifestyle. How do you see that playing a role in the cardiovascular?
Yeah, okay, I get that. Okay, I get you. You know, I think, you know, as a functional practitioner, you know, my thinking is always what is searching for the underlying mechanisms or the root causes that are leading to, in this example, cardiovascular disease. And so Dr. Burke, you know, brilliantly showed all those different tests that we're looking at that can show the degree of cardiovascular disease, the degree of your calcium score, and the risk factors that are involved. You know, I'm coming from is, you know, what is really the underlying, the root cause that's leading to cardiovascular disease. And so when I ask, you know, people and say, well, you know, really what is cardiovascular disease? What is cardiovascular disease? And people will say it's, you know, the arteries are blocking and it's causing heart attacks and strokes. You know, but the answer really is, and it was pointed out in the slide, is that cardiovascular disease is actually inflammation in the cardiovascular system. So the question I ask people is, okay, what exactly is inflammation? And so most people really can't give me an answer, but I'm just going to tell you, but inflammation is an immune system reaction. That's what your immune system does. Your immune system creates an inflammatory response. Right? In acute situations, that's perfectly fine. If you sprain your ankle, that's great. It swells up, it gets hot. Your immune system is sending chemicals down there to clean up damaged tissue. And after 2 weeks or so, you can take the ice pack off and you can kind of limp around, you feel better. But if a year goes by, if 5 years goes by, and you're still putting that ankle, you're still putting an ice pack on that ankle, you would say something is terribly wrong here, because the inflammation is not calming down, and we refer to that as resolving. The inflammatory response is not resolving. My job is to try to figure out what are the contributors that keeps driving that immunological response that is percolating that inflammatory response. Now, there are many things that we know, from blood sugar to toxins in the gut to viruses and different things. But your question was posed about COVID. So certainly COVID has turned the world upside down, right? And it's in a lot of ways, right? Everybody is dealing with enormous amounts of stress, psychological stress, economic stress. And so we know stress is a killer, but stress does a lot of things. right? And stress is going to turn on your immune system. It's going to turn on inflammatory cascade. So it is a major driver to damage to the cardiovascular system. Our diets have changed. People are more sedentary, like you said. Probably people are more emotionally eating. They're turning to more comfort foods. Those foods are typically going to be driving higher blood sugar levels, insulin resistance, prediabetes. These things are going to cause a surge in triglycerides. The triglycerides are one of the major drivers for plaquing in the arteries. Then again, we have also, because of stress, is our sleep is disrupted. So these are the major lifestyle things: blood sugar, sleep deprivation. Right? When you have sleep deprivation, you can't get into deep recuperative sleep. You're suppressing your immune system, and you can't become. So the very nature of lack of sleep is pro-inflammatory. Right? And then, of course, then comes exercise. And so people aren't exercising as much. So we're eating more sugary processed foods. We're not getting adequate sleep. We're not exercising sufficiently. These are some fundamental lifestyle things that need to be incorporated, and they need to be incorporated sooner than later, basically. But COVID has had an impact on all those things. There's no doubt about it.
Dr. Burke, like, what are you seeing at Valley Health in terms of trends in last 7-8 months due to COVID?
I mean, I could tell you, I mean, it's very, very easy to see that this COVID lifestyle has done no good for anybody. People who we have not had regular follow-up with, who've missed appointments because of fear for coming out, are coming back. We're calling it the COVID-15.
Mm-hmm.
You know, it's the average weight gain is around 10 pounds. The healthy lifestyle habits that they had started with have been replaced by unhealthy habits due to fear and anxiety, stresses. I mean, all the things that make people turn towards more comforting options. So nothing good. I mean, that's not even speaking to the COVID effects, you know, on the heart.
So what will you suggest to the audience here, like given the situation or the new normal that we have achieved in the COVID world, what will be some of your suggestions to kind of change or adapt when you cannot go to gym as we were able to do before COVID? What will you suggest, some of the suggestions that you have thought of?
Well, I think the whole idea of I can't exercise because I can't go to the gym is you know, it's out the window. Mm-hmm. We have to realize that we didn't even have gyms, you know, I don't know how many 100 years ago. We have to go outside and we have to do what we can to be physically active in the environment that we have here for ourselves. And it's also safer to be outside. And so if you want to go and be social with somebody, it would be nice to take a walk with them 6 feet away and be outside and be able to do that and get that sense of social connectedness that we all need so very badly.
Yes.
Let alone the isolation and what it's done to our patients has been horrible, actually. So
I'm seeing both sides of it. Are you seeing both sides of it? I have just people in my world, I'm not a physician, but just in my world, I'm seeing people that are sort of resigning to gaining 10 pounds and resorting to more sugary foods and wine and just using it as an excuse to whatever, this is stressful. And then I see other people that never really went to a gym because they drove to the city every day to work. And they were like, I have an hour now. And now they've lost weight and they've taken control of their health and they've had a glow up. You know, they've had this time where they found, it was found time. They started cooking more instead of taking out. So I feel like I'm seeing both, but probably in your practice, you might be seeing more people that aren't making it there. People that already are sick and they need to, you know,
It's,
So-
but you know, of course I'm skewed. So I have a, you know, a
Yes.
cardiology, a cardiology population that's already seeing a cardiologist.
Right,
So
right.
they're not those. I wish they were. I wish they were the latter, but
Right.
they're
I
not
think it's
those.
very hard to do that, but I think the people that are really health minded and health focused make sure to carve the time to take the walks with the people and the friends that keep them stress free and do that, which sort of leads to the next question, which you've both already covered, which is basically.
One more top.
Oh, you have another question?
Yeah. So in terms of the age factor, right? Age kind of is not a friend for cardiovascular situations. But do you see the age kind of coming lower and lower? Like more younger people, relatively speaking, are getting impacted? Because I was hearing the news, like somebody has to go through one of the CEOs of, I forgot the name of the company, has to go through pacemaker transplant this afternoon in Tampa. So do you see a trend that more relatively speaking, younger people in their 40s are kind of also kind of becoming uh, having cardiovascular situations and anything like that, like more younger, like in terms of more, like people in 30s and 40s have to look out for something or have to change their lifestyles, both for men and women side, like
Who you're asking?
anyone of you can pick and go and then.
Well, I mean, like, I mean, for Dr. Burke, obviously people are going to be seeing her for cardiovascular issues. They know they have a cardiovascular issue or suspect of it.
Mm-hmm.
The patients that I see are not necessarily coming to me for cardiovascular issues. At least they don't realize they have it, right? They're coming to me for a lot of other things. They're coming to me for gastric distress. They're coming to me because they know they have autoimmune diseases, or we're diagnosing autoimmune diseases, right? They're coming to me for neurological issues, everything from brain fog to depression to anxiety to memory problems. That's what they're coming to me for. But the thing is that the common denominator is that vascular health still is connected to all of those things, right? When you have compromised the vascular system, you're not getting oxygen to your brain. There's going to be changes and damage to your brain. That's where you get vascular dementia. So it's not just heart. Cardiovascular disease affects every organ in your body. But the people that I'm seeing, the cardiovascular stuff is not on their radar screen yet, right? Right, we think it's an older person's disease. When people get into the 60s, well, they start getting a little bit more nervous about cardiovascular health. They take it a little bit more seriously.
Yeah.
In younger people, I can say, being kindly, it's not sexy yet, right? And they don't think of it as sexy, right? It's almost like we have to kind of change the language a little bit. We got to make cardiovascular health sexy. That's what we need to do, right? Yeah. If you start thinking about, like, if you have better vascular health, right, what's going to happen is you're going to have more energy. Who doesn't want more energy? People want more energy. They're seeking for energy, right? But they're not connecting that their vascular health is going to improve energy. A lot of people want to have better skin, better glowing skin, where you got to have good vascular microvasculation, bring oxygen to your skin, healthier vascular system, healthy glowing skin. And you start changing the language a little bit, you start making it a sexy thing, and then you're going to get younger people saying, I got to check my vascular system because I want to look better.
We need to collaborate, Dr.
Right. Yeah, there's a lot of truth to this, right? Is you got to
Yes.
just, it's just how we look at it.
Yes.
Because it is true that it is affecting younger and younger people. There was a recent study that said that if you go back, today's generation of adolescents has a poorer cardiac, Dr. Burke can say it better than I can, better, at least a shorter cardiac output, maybe less endurance, poorer endurance from a cardiovascular standpoint than my generation. So the kids today in 2020 compared to a generation back into the 70s and 80s, that the endurance capacity is changing. Their cardiovascular health is getting weaker. And what do you see in young people, right? You're seeing what we used to be called adult onset diabetes is now being diagnosed in 8, 9, and 10-year-olds. Right? We have adolescents that are less active, that are more obese than in previous generations. Right? Now this is all part of society with more computers and gaming and different things, and kids are less active. And unfortunately, they're in schools, when schools are open, they're taking away gym classes and different things, and they're making a society of less active kids.
Yeah, no one's walking anywhere
Yeah, and they're eating a lot more processed foods.
Mhm.
Right. I just one more thing before you get on. It's like this is one thing that was always like amazing to me. You know, we live in Bergen County here, and you all remember back in the fall, and on Route 17, up in Mawa, they took down a diner, and what they built in place of this diner was a Chick-fil-A. And I remember just watching this thing go up. And when Chick-fil-A finally opened up, I kid you not, they had to have state police there because the cars were backed up onto the highway for about a half a mile. Right.
Wow.
And it was like that day and night and day and night. And they had like two lines of cars going into Chick-fil-A
Mhm.
and people eating more of it with COVID. So we're just getting more and more processed foods that are being uh, fried in hydrogenated oils, which is terribly inflammatory, if not carcinogenic. You know, and this is what we're doing, right? So you know, got to get the message out that that we have to. Parents, I think, in my viewpoint, parents really have to start taking a little bit more control over their young kids and being a little more directorial about their health and about their eating habits and their exercises.
I couldn't
Dr.
agree
Burke,
more.
yeah,
And
Dr. Burke, what do you have thoughts about the younger population getting into this, or kind of starting this silently into their health system before it's like starts showing up? It's a bit late.
Yeah, I mean, I can't quote you any studies on when the presentation in terms of the trend. I think I can't say for sure that that trend has been seen yet. What has been proven is that younger people presenting with heart disease are sicker because if they have heart disease already at a young age, they are sicker because they have ignored it because they think this is, of course, not my heart. So that is a major problem. But the younger it's the younger people that is the most critical because we can't do anything with prevention when we have people coming to us, you know, at 80 years old with heart disease. We have already missed, you know, the boat. We have to already capture these patients at 20 and 30 years of age to talk about what's important and establish those healthy lifestyle habits, because it's extremely hard to change those habits after they've been established for 60 years. It's much, much easier to make those changes as, you know, teenage into 20 years, and to understand when you're leaving your parents' house, this is how I want to live my life. These are the foods that I want to eat, and I know I need to be active. You know, those critical things, the food, the you know, the social, the interpersonal relationships, the relaxation techniques, the coping mechanisms, those are what we need to get to.
Dr. Burke? Oh,
Did I go? Did I leave?
I think you left for a second. These are amazing answers, and you both have touched upon almost all of the questions that Anil gave me, but I guess if it talks about lifestyle changes, what would be lifestyle changes that you would tell someone in their 20s besides just eating clean and exercising? What would be, they would leave your office with a list of things to do, from meditation and exercise, and what other types of ways, medications or supplements, or ways to prevent these conditions? You kind of already touched upon it, but is there anything else you want to add to that question, either of you?
I'm sure Dr. Pucci has a lot in terms of prevention that that will be wonderful pearls. I'm going to share one slide that I used for every patient that I want them to think about.
Please.
When they come to me and prevention is on their mind, we talk about fresh. Oh, I have to be enabled.
Okay.
Rajna?
Oh, good. Okay, so we talk about fresh. So when we talk about a basic acronym in terms of trying to keep somebody's mind on prevention. So on a day-to-day, think about these 5 aspects of your life. So F for food. So what am I doing today in terms of what am I putting in my body that's going to be good for my body, right? This is basic nutrition, which is basically the backbone of prevention. R is relaxation. So what did I do today to bring myself down when I know I'm at a high stress state, which a lot of us have been in for a constant 365 days now. We're going on the anniversary of the pandemic shutdown. We need to now realize, what are we doing every day that's beneficial for coping strategies? E, what did I do for exercise today? Did I keep myself physically active? Is there something I could do even now just to get myself going for 20 minutes? S is sleep and social network both. So what kind of interpersonal relationships have I had today? Will I feel better if I call my best friend and talk to her for 10 to 15 minutes? And what kind of sleep patterns have I been seeing over the past few nights? Because maybe that's not optimal for me at this moment. And last is H, and it's pursuit of happiness. So what am I doing each day to make sure and ensuring that what I'm doing here is making myself happy? And there's something that I'm doing that's going to achieve a goal of happiness for myself.
I love it.
So
I
that's
have
just
a question.
that's a brief statement. I like I said, Dr. Pucci, I'm
Right.
sure there's a lot in terms of prevention.
Before Dr. Pucci answers that, I have one question. Say a woman, 47 years old, has most of these things really under control. The fresh, maybe the S is a little, the sleep part. What are the chances of somebody who eats clean, lots and lots of healthy organic fruits and vegetables, not a lot of inflammation foods, and exercises every day, if she were to get stressed or not sleep well, like what kind of chances of a heart problem if she doesn't have a heart disease in her family? My question is, would you go to a cardiologist to check just to be smart, even if you had a fresh outlook and everything was looking good? At what age would you go and check it out if nothing was wrong?
Let me jump in here for a second.
Yeah.
The questions, my head's going a mile a minute here on this, but I think I want to give you a little story. I think that's going to help.
Good.
Because again, it's like I said, we got to bring sexy back, right? Because it's like, well, why am I going to go seek things out? We're not making connections to things in the vascular world.
Right.
But, there are a tremendous amount of people that have autoimmunity, such as thyroid, Hashimoto's thyroid, or multiple sclerosis, or rheumatoid arthritis, or ulcerative colitis, and the list goes on, right? See them all in my office. And I think that what people don't realize is that there are many contributors to cardiovascular disease, many, but autoimmunity is also there too.
Right. You
can have autoimmunity against your heart. You can have autoimmunity against your blood vessels. And I have seen that. I'm going to give you just a quick little story because I had a patient, still a patient, but 2 years ago, she's in the gym. She's 60 at the time. She's in the gym and she's working out like she always does with her trainer. And just one day, and she's pretty physically fit. She eats great, lots of energy, but also this one day, she just can't, she's in the middle of her exercise. She can't function, completely exhausted to the point she can't even get off the bench, off the chair. So they get her to the emergency room. They run all kinds of tests. And they set her back. I said, no heart attack, just a lot of stress, and just go back. And she calls me the next day and she's telling me the story. And I said to her, it sounds to me like you had a heart attack. And she said, no. They said the hospital, the emergency room said, no, I didn't. I said, okay. Anyway, she went to her primary doctor, did an EKG, and then they said, well, we're seeing some signs that you might have had a heart attack. Okay, let's just fast forward 2 years later. And she calls me from the shore and she's having some issues, and we ran some blood work. And this is the short of a long story. Her liver enzymes are through the roof in hepatitis territory. One thing leads to another. She's seeing a specialist in New York City, a liver specialist who's doing biopsies, who basically says what they feel it is that it's an autoimmune attack, autoimmune hepatitis, they're calling it. So the doctor in New York knew what I was doing and was good with it, and I was happy to hear that. So we ran some more tests while she was going through this process, and we ran a full what's called antibody panel against 20 different tissues. And of 20 different tissues, 12 tissues came back positive for antibodies, and 2 of them were against heart. So when I saw that, I said to her, conclusively, you had a heart attack because it's autoimmune driven. You have antibodies against your heart muscle. So then we want to take it a step further, and we want to know what might be driving this. And so one thing we did is we ran a panel for pathogens. And it runs like 30 different pathogens or 28 pathogens. And I think 8 came back positive. So she had high elevations for Epstein-Barr virus.
Wow.
And we know Epstein-Barr virus does affect cardiovascular system. Okay, co-activates the cardiovascular system. She had elevations in herpes virus, cytomegaloviruses, and she had Lyme's, positive for Lyme, for Borrelia,
Wow.
and Ehrlichia. So, and these were active infections.
And no indications until that time on the bench.
Well, my point is, this all came about after her liver enzymes were through the roof, and that propagated further testing, and the testing shows these multiple antibodies. So you can have antibodies that are sitting there for decades. So if a person has any diagnosis of autoimmunity, you have autoimmune thyroid, Hashimoto's hypothyroidism, it's probably not a bad idea to get a full comprehensive autoimmune panel.
Right.
And if you see that you have antibodies against your heart muscle, that's on your radar screen.
Yeah.
Right. And then you're going to start taking, so you can be eating a so-called healthy lifestyle. But let's say that you're eating things, or there's certain triggers in your gut environment, because even healthy foods can be a trigger to the immune system, and that food can cause that immune system to cross-react with the antibodies against your heart.
Mm-hmm.
So people eating health, I'm just going to use a small example.
What do you suggest? I'm not understanding. What are you suggesting?
What I'm suggesting is that there are things called cross-reactivity. So if you have antibodies against your heart, we know the science shows us that if your immune system is reacting to gluten, okay, it cross-reacts with the heart muscle. So now eating gluten will increase your risk of developing a heart condition or cardiovascular disease. Okay, and there are other things too, right? So we want to be able to figure those things out. We want to figure out what foods may be a trigger so we can work with the person to get those foods out. Okay.
But people can still go to a cardiologist and everything.
They should go to a cardiologist, absolutely.
And then the next day have a heart attack.
Well, again, because, you know, if you're looking at from a cardiological standpoint, if you're just looking at markers, right, and you're measuring calcium scores and whatnot, look, people, if you look at the studies, right, if people are put on statin drugs, does the statin drug lower the cholesterol? Yes, it does.
But it's negative.
Right.
What's that?
But statin drugs are negative to the rest of the body.
But the point is, the statin drug does lower the cholesterol.
Oh yes, and a lot of other things.
But still 50% of the people that die of heart attacks still have normal levels of cholesterol, right? So, so my point is that if you're going and you're integrating, right? And so if you're working with someone and they got you on blood pressure medications, if your blood pressure is high, you should be on blood pressure medication, right? Because you don't want your blood pressure banging on those arterial walls and shearing those arterial walls and creating inflammation. So you want to be on the blood pressure medication. My job is to figure out what is causing you to have high blood pressure. You don't have high blood pressure for no reason. Something is driving and causing the high blood pressure. My job is to figure out what that is. And if we can get to that root cause and start eliminating those factors, then maybe at some point you might even be able to get off your medication, or at least lower them, because you're getting healthier.
Right. But many times, just like Dr. Burke said, with the fresh, the fresh and with the proper breathing besides fresh, and with the affirmation and visualization besides fresh, most of the time we can control our blood pressure. Most of the time we control.
Sure. Yeah, those things are absolutely.
It sounds like we should find out if we have any autoimmune situations as well, because it sounded like this one, she had no idea that this was going on in her body, which led to all of these problems. I had COVID, and a friend of mine, same age, COVID, she has Hashimoto's. She was so ill, so ill, to the point where wasn't sure what was going to happen with her. And she's well now and it's fine, but
And she survived.
she survived.
She
But I
survived.
had it so mild because I don't have that. And I think that just like everything, any type of situation, if you have an autoimmune disease, you're at a higher risk.
But did she follow, besides having that, did she follow what Dr. Burke said? And also learn about proper breathing, and also.
Yes, she did all of the breathing, all of the, yes,
But
yes.
the
and she-
autoimmune system, yeah, so she knew she had that.
Yeah. Mhm. So knowing, I mean, these last few questions have completely been answered by Dr. Pucci and Dr. Burke, but it's like, what other comorbidities that complicate the condition and increase the risk? How do blood pressure and diabetes and autoimmune disease and these modalities play a role? So we know that they exacerbate the situation. If you want to add to that, Dr. Burke.
Well, I have to add gender-specific issues because this is my
Please.
baby. This is my life. So women in particular, thinking about cardiovascular risk, you know, they were told about those basic risk factors I talked about from the beginning, but we now know that a history, so pregnancy adverse outcomes. So for example, preeclampsia, pregnancy-induced hypertension, gestational diabetes, preterm labor, small for gestational age, those things are risk factors for cardiovascular disease in the future.
Wow.
We can have preeclamptics become hypertensive patients in 1 to 2 years after pregnancy, and they can be young, healthy women. But something is going wrong at the cardiovascular level. Then there's things like PCOS or polycystic ovaries, irregular periods. There's the idea of hormone replacement therapy, and if that's giving you an increased risk, because some patients are on them for a little too long, and potentially they already have risk factors for cardiovascular disease, that's only making things a little bit worse. Then there's the idea of having had breast cancer in the past, or things like Hodgkin's lymphoma, for which they had to receive radiation at a young age.
Wow.
Those patients are at added risk for cardiovascular disease early. 10 years after any radiation to the chest, you are in a very critical period for cardiovascular disease development, and we urge you to get screened at that point. And of course, some of the chemotherapies, especially for breast cancer, are known to be cardiotoxic. So we try to capture those patients as well, just to have them think about their history, because it's amazing how many people have come in saying, oh yeah, when I was 12, I had Hodgkin's lymphoma, I survived it. But they had a significant radiation dose to their mantle, which includes the heart at that age. So they have, unfortunately, high risk. So those are just some of the things, besides the typical inflammatory diseases, like all the itises, colitis, arthritis, all of the itises are all inflammatory diseases. As Dr. Pucci was saying, the inflammation is the basis behind cardiovascular disease. So those patients also, those autoimmune patients are more commonly females. So we tend to see those issues also coming up very commonly.
Wow. In other words, we're all at risk.
Some people are very lucky.
Right. Do you think that the doctors that are treating for breast cancer are saying, hey, by the way, this could lead to a problem with your heart in the future. Maybe you should see a cardiologist. Is there like that sort of, hey, you've graduated here, maybe you should now see a cardiologist? Is there that sort of communication? Or
so these days, most places do have what's called cardio oncology or survivorship programs. So that's run usually by it's myself and one of the oncologists at Valley. So these it's very, very big in the past 5 years in terms of getting the word out there and making every patient aware in terms of risk.
That's amazing.
There are a couple of things like somebody pointed out that magnesium oxide has been recommended by their cardiologist. Does that make a difference, or what is the role magnesium oxide has to play in the whole process?
Dr. Pucci?
Well, you know, with palpitations, is palpitations the question? Yeah, palpitations. So the question is, from my viewpoint, is what's really causing the palpitations? I mean, the answer simply is magnesium can be helpful. All right, but what's the mechanism there, right? So when I look at palpitations, I kind of look at it from a brain perspective. Again, the brain is the organ that is regulating the heart rhythm. And so oftentimes when we do more functional neurological evaluations, we see some dysregulations in maybe the right hemisphere and the left hemispheres of the brain. And that dysregulation is affecting the rhythm of the heart. Also is your thyroid too, because with palpitations, it could be thyroid related. You have to make sure that you don't have a hyperactive thyroid condition. But magnesium itself, you know, is kind of counter calcium. So calcium is going to be constricting and magnesium is going to be relaxing. So most people are magnesium deficient, way more than calcium deficiencies. And so yes, magnesium, again, can calm the brain down. If you calm the brain down, you can maybe re-regulate the autonomics to the heart itself.
Okay.
Thank you.
One more thing, why don't most of the physicians do not recommend the full blood work that Dr. Pucci, you have been recommending, and Dr. Burke, you recommended? Is there a insurance situation?
That's exactly what it is. It's insurance.
Payers are not supporting the fully, or what are your thoughts on that?
It's it's from my viewpoint, it's insurance. The insurance companies are just paying less and less, and so your average primary doctor is just kind of going by insurance guidelines and is just running less markers.
Mhm.
I'm sorry, I was waiting 20 minutes to get on, so I missed it. So what test is that they're not paying, or that you suggest?
No, what I was just saying, like early on, is that when we run a blood test, we kind of refer to it as a comprehensive test, meaning we're going to run more markers typically than just a routine blood test that your primary is going to run. Your primary doctor, when they run a blood test, they're running basically what the insurance is paying for.
Right.
And so they don't run markers that really give us better insights. So from a cardiovascular standpoint, there are some key markers, right? Which is, you know, you want to look at, besides glucose, you want to look at your hemoglobin A1C. Right?
I'm sorry, hemoglobin
A1C marker, right? Your A1C marker is going to be is your average blood sugar over 3 months, right? But it's also it's glucose thickened to hemoglobin molecules, which oxidizes them, which is really bad. It's also very bad for your brain, right? But other inflammatory markers, just inflammation markers. So ferritin is a marker that is, if it's low, it's considered it's iron anemia, but high ferritin is really not overload of iron. It's a marker of acute inflammation. Doesn't tell you what's causing it, but it's inflammation. If you look at markers like CRP, high sensitivity C-reactive protein, doesn't often get run by routine doctors, but it is a really important marker. It's a marker for it's systemic inflammation in the body. It is specific to the cardiovascular system. It's actually a marker of a specific type of immune cytokine called interleukin-6, which is a really important thing.
So what do you do for that?
I'm sorry?
What do you do for somebody that's high in that?
Wow, well, that's the discovery process. You got to figure out what is really driving inflammation, right? That's just the response. That's just saying, okay, there's inflammation in the body. It doesn't tell you what's causing it. One of the things I didn't kind of allude to, like, you know, there's many causes we both agree that can cause cardiovascular disease. But one of the most common things that people don't know about is something called endotoxemia. Endotoxemia. What that is, right, is in your digestive environment, in your large intestine, which we call the microbiome. And many people have heard of the microbiome these days. But your microbiome is an ecosystem of billions of organisms, of bacteria and viruses, tens of thousands of viruses, yeast, fungi, protozoa, and they're all coexisting down there. But there's kind of a push and shove. And so when we talk about lifestyle factors like lack of sleep and stress and poor diet, those things dramatically influence that ecosystem, and it pushes it more in favor of an overgrowth of bad bacteria. The bad bacteria are made up of something that's called a lipopolysaccharide, or LPS for short. So when the bad bacteria are dying off, they release this lipopolysaccharide, which is a toxin. So it's called an endotoxin because it's made in your gut. Now, if
Oh,
it
it comes
stays in your
back to the gut, right? A
yeah,
lot of it.
so if it stays in your gut and you move your bowels and it clears it out, that's a good thing, right? But if you have what is called dysbiosis, an overgrowth of this bacteria, and you're getting high concentrations of LPS, and one of the things that stress does is it causes a breach in the barrier, which we call leaky gut. Everybody's heard of that. So now these endotoxins in your gut are leaking out through the barrier and getting into circulation, into your cardiovascular system. And now you're moving these endotoxins throughout your circulatory system. So
So
it's
do
in your blood,
probiotics,
so they call it endotoxemia, right?
do probiotics help negate that or no?
Yeah, it's helpful, right? But it's really more lifestyle interventions and diet and stress and different things. And probiotics can be helpful, but it's such a new field that most of the probiotics that people are taking are not going to come close to really cultivating the microbiome that they really need. The best way that you can cultivate a microbiome, besides a probiotic, outside probiotics, is the diversity of your diet, specifically plants and vegetables. Not the diversity of animal products, the diversity of plants and vegetables. That's what's feeding the bacteria. So your bacteria are eating what you eat. You eat what the animal eats or what the plant eats. If the plant is eating fungicides and herbicides, you're eating fungicides and herbicides. If the animal is eating antibiotics and grain, you're eating antibiotics and grains. So you eat what the animal eats, but the bacteria that live in your gut are eating that food. And
that's very interesting, Dr. Pucci.
and it
Yeah. So, Dr. Burke, like one of the questions, these tests, like, do the sensitivity of these tests changes with age for the patients, or how does it change? Like one of the participant is asking that question, that they have done this test like some time back, like what should be the frequency of these tests, and how does the sensitivity changes for these tests?
So, you know, we don't, in our practice, we don't run a lot of these. First of all, in cardiology, we, besides, of course, inflammatory markers, which I would hope most cardiologists run at this point, there's enough established data behind that. I'm not sure which sensitivities that this person is talking about in particular. I don't know if
You mean results, Nancy? Do the results change with age? If you're, take these blood tests? I would imagine they would change. Yes, she said yes. So I think do the results change if a few years ago she took these tests and in a cardiologist's office? I guess, and Neil is adding, like, at what point would she need to go back if everything was cool? Like years ago, I was told I should eat goat's milk and duck eggs. She said, why? I don't know. I don't know.
Yeah, we don't do food sensitivity testing in my cardiology practice, and
I see.
Or any of them in Valley. So I don't know if Dr. Pucci does food sensitivity.
I
but
do.
I think the underlying question here is that these tests that people do it, like at certain age, like the frequency changes, or if they start monitoring some certain symptoms or certain changes in their body, or their like how they feel about themselves, they should start looking at it, or change the frequency of this, like every 2 years, every other year. Like how should they be conducting these blood work or some of the markers that they are looking for?
Yes, I'm assuming if your body chemistry changes, she says with age, that the inflammation causes change.
Like I said, I'll have Doug answer because he runs these tests.
Yeah.
I'm just trying to understand the question here, which is what? I'm assuming if your body chemistry, what's the question exactly?
I think it's food sensitivities and will they change?
Some will and some won't. If a person has an underlying autoimmune condition, there are certain things that probably need to be out for life. But oftentimes that many of the food sensitivities that people have, and people develop a lot of them, by the elimination of them for an extended period of time, and that's different from person to person, right? This is very individualized, but yes, many foods that are reactive today may not be reactive 6 months from now, and they can be reintroduced, maybe sooner, maybe later. But it really requires, it just depends upon the person, what they're doing, right? So, the biggest obstacle is really is patient compliance, right? Is getting people to comply with doing things and taking action. That's the main thing.
which is extremely difficult,
It
especially if
is.
you're getting into elimination diets.
It is, managing is a tough thing. So you have to meet people where they are, though. That's the key, right? So I've learned from a lot of years of experience is you just can't dump on somebody like just take all this stuff out. It's just you got to meet them where they're at and what they can do.
Yeah.
And it's kind of like I ask people, can you do this for 30 days? And if they can't, I'm like, well, can you give me 10 days? And if they can't, can you give me the weekend? And if you can't, can you give me one meal a day? Can you give me one meal a day that you can get right? Right? And can give me breakfast. Because you can get the breakfast right, maybe we can get the rest of the day going. And so you just kind of meet people and you got to build some momentum. But when people start to feel better, they get a little more encouraged. And that's what's pretty kind of cool.
Okay.
Right? So everybody is a little bit different.
Yeah.
Some people can take a boatload of supplements and some people take 3 supplements and are overwhelmed. So you just got to work with them individually.
So, Dr.
Which leads me to the question, what makes it sexy? How can we make it sexy, like you said, Dr. Pucci? Like, how can we as a society, there's insurance involved and people don't go until they say you have to go get a mammogram at this age, you have to go to a cardiologist at this age, this is what's covered. Unless you're like-minded wellness people who are willing to go see the doctor who's going to do the comprehensive tests and really get to the root of the problem. What can we do as a society to make it exciting to be proactive about our cardiac health? Sorry, Anil, I know you wanted to ask a question at the same time.
No, I think it's a very good question. So
Thank you.
Go ahead.
I think you should both answer what would be in your practice. What can we make it? What can we do? One thing. Make it sexy.
I feel like if lifestyle change was sexy, then everybody would be doing it and we wouldn't have these issues. It all comes back down to lifestyle change. So what makes that sexy? Like Peloton has made that pretty sexy, I have to say. That's been the biggest hit in activity and physical home activity since in the past 5 years. So there are things that come about that seem to make, like yoga was the 10 years prior, right? You couldn't throw a stone without hitting a yoga studio, at least in Bergen County.
Right.
So that was the trend, and so things come in trends when we know we need to work on them.
I think the whole thing is sexy. I mean, people are looking good, people feeling good. As she said, the yoga centers. I mean, I think one of my yoga students opened up the first yoga center in Bergen County. But I mean, the people meditating, people going to health clubs, people going to Whole Foods or Trader Joe's and looking good and they're vibrant and they're vital versus somebody walking out of McDonald's. I mean, to me, it's community makes it sexy, and being with these people and doing it because they are. I mean, they're vital. They're alive. They're open. They're wow. I think the whole movement is sexy.
Me too. I think it's who you hang around with, right?
Yeah,
That's
community. 100%.
Dr. Pucci, what's your thoughts on that? Like, what are some of your ideas to make it more, make this thing more relevant in people's life, where they kind of feel that this is something they have to do?
Yeah, I think what Mark kind of hit it on the road. He said it correctly. It's a whole lifestyle thing, and you go to areas, Whole Foods, and you feel it. But really, what it is that I'm learning, and I continue to learn. Right? If I just, as a practitioner, tell people that, oh, this is what you need to do. You got to do this, like on this platform, that's not going to be good enough. You have to be a really good listener and say, what is the person really looking for? What do they really want? All right. When people come to me, they come to me with a complaint. Here's their list. Here's all their symptoms: headache, digestive problems, blah, blah. But really, what is those symptoms costing them? What is it that they really want? What they want, right, is they want to have energy. They want to have virility. They want to be attractive. They want to have great skin, right? People spend a lot of money in cosmetic products, right? But again, vascular health is going to improve your skin. Vascular health is going to improve your overall vitality and your sexual performance. right? If we start thinking about positive health changes in a way that really resonates in people's day-to-day lives of what makes them tick, especially with younger people, you're going to get a lot more people involved looking to be more proactive about their health rather than reactive to it.
Exactly.
Right, that's the whole point. That the world that we're living in is that we're in a medically it's a reactive world in medicine, drug interventions for symptoms versus a proactive world. So you got to make that proactive approach really resonate, which most important for that person. What's
So
important to a
Dr. Burke,
60-year-old is different than what's important to a 20-year-old.
yeah.
Right?
So Dr. Burke, you just responded to this in the chat, but can you talk a little bit about the supervision center at Valley Lifestyles in Mawa? Like, what exactly is that program that you're referring to?
Yeah, so many patients, I mean, have asked about this since we opened, but even, you know, Hackensack had medical gym first, and this is really the trend for hospitals to have medical gyms where they have supervised exercise programs, mainly for cardiac rehab. They have pre and post rehab for joint replacements, but they also have training programs that can be done there. I mean, these gyms are not for your typical 20-year-old crowd. That's not who's going to be, you know, at Valley Lifestyles and most of the medical gyms. These are mostly patients. Perhaps they've come through a bad hospitalization and now they're working back on their health again. I mean, the feel in there is just completely different than any gym. It is where you go to get well, and I think that you would feel that as soon as you walk in there.
I love that trend that we're seeing. I'm on the board of the Graph Wellness Center at Englewood Hospital, and I love that it's a spa situation, but it's not. You don't have to be coming there because you have breast cancer or you're visiting someone. You can go there for meditation and nutrition and Reiki and all these things, and that's the whole goal for them, is to try and make it sexy, to bring people in to come and be proactive and not be there only because you're so stressed out because you're in the hospital or someone in your life is in the hospital. And that's the only reason you're getting a massage or getting Reiki or acupuncture or exercising. I think it's great that Valley has that. And I thought Lifestyles had a lot when I was there. I thought that their yoga studio, I think I'm talking about the same place. Do they have a huge yoga studio? Yeah.
Yoga studio.
Beautiful space.
The Lifestyle or the Hackensack Center, both of them are like kind of a small village, a fitness village, if you can call them.
Yeah.
They have swimming pools, they have gyms, they have all the machines, cardio classes going on. They have a small daycare for the kids. If you have kids and all that, you can almost deposit them over there for like a few hours and do whatever you have to do. So these are very good centers. And as Dr. Burke said, it is about getting well.
Yeah.
It's not about like gym. They are not gym really. They are to get well. And they do all kind of aerobic, non-aerobic, fitness, weights, whatever you have. And since it's a guided program, there is it's not a fitness guru there. It's a wellness guru who is helping you out.
Yeah, and you don't need a doctor's referral.
Yeah, and how about to go to a cardiologist? Do you need your PCP to give you a referral? And like, is that an insurance situation? That begs the question that I started asking at first, like at what age is it like advised to go see the cardiologist?
So yeah, I was saying before we signed on, we always depend on the primary care doctors to dictate and to help us sort out who really needs us and who is good with their primary in terms of prevention.
I want to come to you, even though I don't know if I need you. Can I come?
Sure.
Can you come without a referral, or you need the referral?
Yeah, no, these days most insurances don't need referrals, but there are still some, but most of the time new patients are coming on their own regard or at the advice of their primary or their best friend or spouse, typically.
Right.
So that I think leads us to the next segment, like Dr. Burke, like what are the new trends in terms of clinical side to take care of the patients? Like I know like stents were there a while back, then the statins came in almost a decade back. What are the new things happening that is making it easier to detect and diagnose the cardiovascular conditions that people are having?
Well, I could tell you that cardiology is a field of a lot of very old and a lot of very well established testing. So stress testing, for example, has not changed in 50 plus years.
But it has evolved with the like newer dye-based testing, right?
So what is newer is the CT scan based diagnostics, and of course procedures that they do in the cath lab. So interventional procedures, this is all for established coronary disease, right? This is not, we're no longer talking about prevention.
Exactly.
So, you know, the big things, if you want to say sexy things, TAVR, for example, replacing aortic valves without doing open heart surgery, mitral clips or repairing leaky mitral valves without doing open heart surgery. So these are the newest and greatest things. Taking away areas of the heart that could be potential areas for clot if you have something like atrial fibrillation and you can't take blood thinners anymore because of bleeding. So these are all invasive, very invasive, but yet procedures that are much better than they used to be, right? Open heart surgery is still, I say, to this day, one of the biggest surgeries we do on man. It is a very big undertaking to undergo, and the recovery process is an arduous and long one. So anything that we could do that is considered non-invasive or through the blood vessels is considered a breakthrough. So that is all, you know, newer in terms of the past decade or 20 years or so. But in terms of diagnostics, yes, it's still the angiogram in the cath lab that's going to be the place that you're going to go to get the angioplasty, the stenting that you would need. And of course, these days,
are they good? Is that good? The angioplasty?
Is it good? Well, if you're having a heart attack, it's going to save your life. And it does so every single day in every hospital in the United States and across the world. So yeah, so it's, but stents, just because you are asymptomatic and the doctor decides to put you on a treadmill and the treadmill test looks a little off, and then you go to the cath lab and there's maybe a blockage and you get a stent, no good. Right. So that's been proven. Stents are there for quality of life or in a life-threatening situation. Right. So a complete blockage in an acute setting like that, yes, that's a good use of a stent. Somebody who's having life or symptoms that are ruining their quality of life in terms of chest discomfort, shortness of breath, they can no longer even get to the bottom of the driveway to get the mail to the mailbox and go back anymore. Yes, stents can help their quality of life. Will it save their life? No. But it will help their quality of life.
So if the proverbial should hit the fan, which hospitals would you go to?
Valley, of course.
So that's the hospital to go to. Okay.
Well, I've worked there for 10 years, and I came from Columbia and UC San Diego, which are two extremely well-known and very good hospitals. And I think that Valley has care that is at par. And
great. And where is that?
Where's Valley?
Yeah.
Oh, in Ridgewood, New Jersey.
Okay.
Yeah, it's in Ridgewood, and very soon it will have a new home in Paramus.
Yeah.
So.
Wow.
Wow. I mean, when will they stop sawing chests? I mean, that's so archaic. It seems like by now we should have a better way of doing open heart surgery.
Well, you know, these days, most patients that are coming in with blockages are getting stents. So 8 out of 10 patients who have blockages get stents and not bypass. So
That's
it's
great.
much less.
So Dr. Pucci, like, what are some of the newer approaches that you are seeing from the functional and integrative health that are coming into this space?
In terms of integrative health,
Yeah.
newer, that's hard to say. I mean, I think that testing for underlying causes it's not new, right? This is not a new idea. This has been going on. I think the testing is getting more and more, it's getting larger, you know, and things that they're finding are potentially more. But really it comes down to those basics, you know, for me. You know, with the integrative training that I've gotten, which is, of course, I'm not a functional medicine provider, but it's always going to come back to the basics, and the basics that we talked about, mostly with nutrition for almost every disease state.
Yeah, and Dr. Pucci touched upon a bunch of it too, that there are so many elements that contribute to your heart health, so many elements. I think seeing both of you would be, if you had a heart condition, would be the ideal situation, right? To be able to test all of those extra markers that a hospital might not, and find out about your foods and your sensitivities and potential autoimmune situations. And just really it just shows that it's an entire thing. It's not just located here, right? It's your gut, it's everything. So you both are just a wealth of information. We have some other questions coming in. Why is a stent only a quality of life solution as opposed to a life-saving or preventative procedure, Dr. Burke?
So I did say it can save your life, and they do every day in the setting of heart attacks or complete blockages. So though in that case, it is very different. It is a quality of life solution only if you don't have any limiting issues and you happen to have a positive stress test. So that has been proven. But yes, they do still save lives every single day in blockage, in complete blockage situations.
And how long could that last, the quality of a stent? It could just stay there for the rest of your life, or?
Stents stay in your heart for good. There is no removing of stents. Some stents stay open for the rest of a patient's life, which could be upwards of 50 years.
Wow.
And some stents close in 2 weeks. So it is all a matter of how they are deployed, what quality of how the procedure went, and how compliant the patient is with their medications, because the first issue that happens in the first 6 months is a clot. It's a clotting issue.
Mm.
So, Dr. Pucci, very specifically, like, what are some of the new things that you are seeing, like in terms of how to address conditions like this for your patients?
Well, again, from my perspective, I'm more in the world of prevention. And even from the standpoint of people who do have cardiovascular disease or post-heart attack, it's lifestyle intervention and the things we talked about. How do we best, look at what is really driving inflammation? And there's many things. And so when we intercede with running functional tests to rule out viruses, to rule out endotoxemia, food reactivities, these things, we address those imbalances. We know just from things like one of the ways to keep your blood vessels healthy, right, is by improving nitric oxide. Nitric oxide, endothelial nitric oxide, is a gas that is produced in the vascular system, and it's induced by exercise, especially high intensity exercise. But there are certain foods too, right? So people are on the craze, and it's a good thing about beets. So beets and beet juices, right? They help to increase nitric oxide, which dilates your blood vessels. That's what you want. Increases more elasticity. We want those things. Little caveat: you gotta be careful with beets because of high sugar, but in general sense. But but there's also like arugula is great. Cilantro. I mean, these things are great things just for increasing nitric oxide levels. So those things are important. I mean, as far as exercise goes, it all depends upon the person too, right? So you got to do what the person's capable of doing. You just can't get a sedentary person to get up and start doing high intense exercises, but you got to start someplace. So any movement is better than no movement. Go ahead.
I've been wondering this whole time. I do the beets and the arugula and the sauerkraut and all that good stuff and the gut. I'm all about it, but I drink coffee. What's your coffee take? What's your take on coffee? Is it a moderation's okay, organic and fair trade and low acidity, or none? Where do you stand?
No, and then there's a lot of research on the benefits of coffee. They're filled with really healthy flavonoids. I would say that, but I drink a cup of coffee in the morning.
What kind?
But well, organic, whatever it
Mhm.
is, it's got to be organic because coffee beans are one of the most.
Pesticides.
That's right.
So many.
Right, and they're held in silos, and they're notorious for mycotoxins, and so many people are dealing with aflatoxins and mycotoxins, which compromise their health, and they don't realize it's the grains and it's the coffee that they're drinking. So, but coffee has a lot of great benefits to it. There's this small caveat, is that when you get into autoimmunity,
Right.
is it all depends upon the immune system and where the immune system is moving towards, and so coffee can activate certain parts of your immune system. So what I just ask people is very simply is that if you're drinking coffee, stop for a little bit and have coffee again. Just how are you feeling?
Right.
I mean, just really, how are you feeling? Some people say to me
Isn't
they feel better.
that with every food? I think every
What's that?
food diet, I think when people eat, they should see what they feel like after they eat,
Right.
and then they'll kind of make up their own type of diet.
Like an elimination diet, right? I
Yeah.
love coffee, and that's why I ask, because I know it's this, like, my husband's like the beet juice drinker, and he's like chops up the garlic and squeezes the lemon, makes me take a shot of it, and I'm all about it. But I love my coffee, and I can drink it like a gallon a day, but I don't. I stop after 2 cups, But I just wanted to know what Dr. Pucci's thoughts on it, because it's a even organic can elevate your heart rate, and it can, depending on the person, and it could be acidic, which acid is inflammation and whatever, but I love it. So, but it has some good qualities.
Yeah. For the most part, yeah. Let's leave it at that. For the most part, coffee is perfectly
good.
fine if it's good coffee. Yeah, I take coffee. You know what? I make coffee sexy. I make coffee sexy. I take coffee and I put a lot of stuff into the coffee.
What do you put in there? Mushrooms?
So I put in some mushroom extracts into my coffee. I will put in some healthy fats once in a while into my coffee. Kind of that bullet.
Some
coffee.
coconut oil or some butter, or what do you do?
Whatever floats the boat that day, but the mushrooms go into the coffee, and sometimes I mix it in with some protein. So I have kind of like a power coffee. Not every day, but a lot of times I do a power coffee.
I'm gonna do a power coffee tomorrow. I'm thinking about
how I feel. Right? If I'm going to drink the coffee,
So,
why not put all this other good stuff in it?
Yeah. So
Right?
I have a question for Dr. Burke here. So we talk a lot about what our food intake is, or what our exercise routines can be around cardiovascular, but the genes part, right, which we cannot control, it's there in our bodies. What are the things that can be done to kind of negate the negative impact of your genes? Like, if we know that we have, there is a family history of it, what do you suggest those patients?
So that's really important. I put this in every presentation I give. I put this a true or false. So I have a family history of heart disease. So I'm giving myself up. I'm going to have it. And the answer is absolutely false, right? So genes have to be turned on. Most of them have to be turned on, and lifestyle habits turn on and off genes every day. So it's extremely important that is not going to dedicate you to a life of cardiovascular or early cardiovascular disease. We see patients like this every day in our practice who come in because of concerns for their family history, and they happen to be okay because they've been living a healthy lifestyle. But again, it's coming down to identifying your risk factors and knowing that you could do something about it, and establishing those lifestyle habits early in your life, not waiting till you're 60 and say, oh yeah, my dad died at 60. Maybe I should start paying attention to these things now. You have to pay attention to them early and that's why it's nice to have them come in early. But again, it's
Such a
not
good message.
not dedicating you to a lifestyle that of your parents.
It's not a death sentence. I love that.
Absolutely
It's
not.
amazing.
Affirmation, visualization. Years ago, I went to a cardiologist. My dad died at 50 from a heart attack. The oldest male in my family was 60. He goes, young man, you're dealt a bad deck. And I'm 73 now. And basically, you know, it's affirmation, it's visualization. What you do is the fresh and the breathing and the affirmation and the visualization. And it's like Dr. Pucci said, it's in the mind. I mean, your nervous system acts according to what you believe to be true. Bingo. So you reprogram that.
You look about 20 years younger than you are. That's amazing. Keep doing what you're doing. Keep visualizing.
No, I mean, and the whole thing, you know.
So Dr. Burke, like following the same thing. So yeah, healthy lifestyle is one, which essentially are you referring to have healthy eating habits and a regular exercise schedule? What that will be like, as like I've read various places, like eat more greens, do like 30 minutes 5 times a week. What is that schedule?
So, you know, there's basic tenets of cardiovascular nutrition, right? So we've all heard of the Mediterranean diet. We've all heard to eat real food, not too much, mostly plants.
Yeah.
We've heard these tenets. This is real life. This is real stuff based on science.
Yeah, you know, I just want you to kind of lay it out for the audience here so that they hear from a doctor, like a practicing cardiologist, so that that it has its own value.
Oh, absolutely. So what my basics for anybody that we're talking to, giving a 1-minute spiel on nutrition, is that you're going to eat as many plants as possible. That's going to be the basis of all of your meals. All of your plates should be as colorful as possible. I don't want to see any whites, nothing white, nothing white, no white breads, pastas, pizzas, muffins, bagels, white. White is not real life. Let's take things from the ground and let's eat them. And I also don't think keeping you know, the good things out completely, that nobody sustains that way. So there has to be, like Gilly asked about coffee. If that's making her that happy, that would never be something that I would say, oh, absolutely not, take it out.
Yay, thank you, Dr. Burke.
Unless she had some horrendous, you know, ulcer disease, you know.
And I have a green juice to counteract it every day anyway. So who cares?
But there has to be a balance. There has to be a balance, right? And everybody knows that they're not eating animal-based meats all day, every day. That has been thrown out for years and years and years. And unfortunately, the fats were replaced by carbohydrates and made everybody even sicker. So it's a balance with whole foods, mostly plants, only grains that come from the ground, that are still brown. These are the basics.
I haven't had meat or chicken since 71.
Wow.
And I remember then everybody said, well, you're going to die.
You're better than I.
Well, at the beginning, I didn't even eat fish, you know, but so many of my friends are vegan, you know, and I was saying before, what you eat, see how you feel after you eat it. If it feels good, because not everybody is the same, you know, really.
It's true.
It's very true, actually.
Yeah,
that's great.
I've always wondered about that, with everyone having a different blood type and being from a different place. I've always heard people say things like, well, I'm from Morocco and my blood type needs meat, and or like, I can't eat beans because I'm Ashkenazic, or like I've heard so many things from so many different people that like they can't have certain things or they shouldn't eat certain things because that makes them gassy. But everybody does have a different reaction to certain foods. And I know a friend who cannot drink coffee because she's like this when she has it, you know? So I do think that you're right, Mark, what you just said. What?
She's still your friend.
Yeah. I can't have coffee with her though. I can't have coffee with anyone right now. But no, this was terrific. I mean, such knowledge, so much to learn from the two of you.
Yeah,
There's
Neil,
a
you're doing
question that somebody,
a very good thing here, Neil.
there was a question that somebody asked about a benefit of going to a female. Do you feel there'd be advantages for a woman going to a female cardiologist? My only take, I would never say, you know, as a female, you need a female cardiologist. As a female, you need somebody who's listening to you. And if that is male, so be it. Just make sure that that doctor is listening to you. And if you feel heard, then you're in the right practice.
Right.
Right? A female, as myself, I've dedicated my life to women's heart issues and gender issues. So I'm very attuned to this. Not every female is very much involved in gender issues. So we can't kind of just say, oh, she's a female in cardiology, she must be attuned to it. I think it's just all about that particular physician and making sure that you're being heard. I think that's the biggest takeaway in terms of your physician, any provider for that matter.
A great point.
And say one thing is let me say one thing is we're here today, it's great, but we haven't talked about, and there's not a dentist on this panel. And dental health is such a critical part of cardiovascular health. I mean, underlying dental infection. So in part is make sure that, you know, that the routine dental checkups are part of your cardiovascular hygiene.
Dr. Pucci, can you elaborate a little bit more on that?
Well, I mean, again, so the dental health. I mean, you're getting you know, dental pockets where you get bacterial infections that are harboring, leading to periodontal disease, but they're harboring bacteria, and the bacteria then migrate into the cardiovascular system, and therein lies a trigger to the immune system. So the immune system now is reacting to the bacteria that's in your cardiovascular system, causing cardiovascular damage. Right? There's also, like, you know, there's considerations to root canals. I mean, I'm not a dentist, but I mean, you know, root canals, which are done routinely to save a tooth, but they're saving a dead tooth. And what they do is by you know, removing the root, is they plug up the root canal, and you have these tubules in your dentin that harbor bacteria. And those bacteria can migrate into the jaw and then into the cardiovascular system. So dental health, I mean, is really, really critical.
So what do you think? I mean, should
Cardiovascular health.
people do root canal or not? Or should they take antibiotics for the, or not?
Well, it's a loaded question.
Yeah,
It's the risk versus reward type of thing. So it depends on the situation specifically. I haven't taken an antibiotic since I'm 15 years old, except for one time, because I went to my dentist and some years back, and he did some work, and a day later I had just excruciating pain. I don't know what was happening. What happened was an infection that I had in my molar migrated and went to my trigeminal nerve. I got an infection in my trigeminal nerve. I told people if I had a gun in my house, I would have blown my brains out. That was how bad the pain was. Got back to him, finally took the molar out, and half that tooth was necrotic. It was dead. But I'm like, you saved me from having a heart attack, getting this tooth taken out of my head, right? The pain continued, but we both discussed it, and I just thought I better get on an antibiotic for a while, right? Because I want to just, you know, calm that down. It was the first time I was on an antibiotic in, you know, 50 years, right? But once I get on the antibiotic, I also know how it's going to wreck my microbiome. So I do due diligence by eating a lot more fermented foods and taking targeted probiotics to make up for that effect of the antibiotics.
I know it was a loaded question, but how they say, like, coincidence is God acting anonymously, right?
Mhm.
So today I went to the dentist.
There you go.
Wait. Why? Because my front tooth hurts. So he took an X-ray, which I don't like to do, and he said, "Well, you have a little infection up there, and I think you really need root canal." So I said, I don't know. I don't remember the last time I took an antibiotic, so I don't know if I feel really good about that. Root canal, I don't know. You know, I heard that's really, you know, getting rid of the nerve, everything is dead. So it's loaded, but it's loaded for a reason because I don't know what to do.
Well, I think you have to take into consideration the whole big picture about what an individual, your case or any individual's total health picture looks like.
I
And so if
like
a person,
that too.
no, I'm saying, but if a person has underlying health risk factors, then probably not doing the root canal and taking it out would be a better choice.
Right.
Right. So it all depends on a lot of different factors. You can also work with a biological holistic a dentist who might opt to try doing ozone therapy
Right.
to eradicate the infection if it's not too deep. So that's something you work out with. I'm not the dentist. You'd work that out with a biological dentist.
Yeah, I know.
Yeah.
Dr. Burke, what's your take on the dentist? Like, what is the relationship between the like situations inside your teeth and mouth versus to the cardiovascular situation?
Yeah, so that's been established as a risk factor. And again, it's the same itis as we talked about before, right? All the itises, all those
Okay.
inflammatory gingivitis, another itis, also
Okay.
causing inflammation, giving you this predilection for coronary disease, which is an inflammatory based process. So it's
So
known,
interesting.
established. Don't ignore dental health.
Your dental health.
One last
What's
question. Dr.
ozone?
Burke. Sorry, go ahead.
Sorry, you can go ahead, Anil. Some people
So-
are talking about ozone is awesome.
So there are this risk factor based algorithms out there, Dr. Burke, which like especially like for identifying the CVD, like ASCVD and all those algorithms. How does that help in population health management? Like, what's your experience at Valley Health with respect to these algorithm based population risk management?
So the ASCVD risk score is used every day. I mean, this is how medicine is shaped these days. You have risk factors; they are made into mega studies,
Right.
and an algorithm is made in terms of, let's make this as simple as possible and determine what this person's cardiovascular risk is based on the known established risk factors. So the things that we talked about first, your blood sugar, if you're a smoker, if you have a family history, your age, what's your LDL, what's your HDL. So you just plug this into a simple calculator and it generates a number based on, I mean, these are huge population-based studies.
Yeah, exactly.
So yes, they are used by every doctor, not just cardiologists, primary care doctors. That's how we get a lot of our referrals based on that number. It's a simple, it's simple statistics. It's take what are the odds? I have this, what are the odds? Sometimes pretty good. So it's I don't think it's a bad thing. I think it's a good way to capture, and it makes things simple, which unfortunately with the amount of people that are going through primary care doctors every day, I think it's something that's needed.
Yeah, I have follow up, and the reason like I am aware of it because one of the things behind you, ShareTech, does some of that kind of work. We kind of create algorithms around health markers, and in that process, like we have done the CVD algorithms for one of the Department of Health in New York City. In that process. Is it a proactive process, like where, like, if the person comes to a primary care or to another doctor, when you talked about the referral system based on the algorithms, is it proactive, or the person has to volunteer that, okay, can you please check if I'm I have a risk factor? What's the real process of the program that runs at Valley Health?
I think it's driven a lot by the cholesterol, to be honest, or age.
Okay.
I think that kind of triggers, if you don't see an ideal cholesterol panel on basic screening, you're going to be put into that calculator to see what your risk factors bring you up towards. It's always driven by one abnormality, not abnormality, but one risk factor. Sorry.
Okay.
Have they ever done a study with the inflammation of the heart and the cryotherapy? And I know cryotherapy is supposed to be really good for inflammation.
Not that I know of. Not big enough, at least to establish it.
Okay.
Dr. Pucci, you have a take on that?
Gilly, you're muted if you're talking.
That's That's because my puppy was barking like a madman, and I just texted my husband, take him out of the crate. So,
So Dr. Pucci, you have a take on
that's the
biotech?
last question. That'll be the last question.
I can't say as far as heart specifically. I can say that cryotherapy is shown in research to be very, very beneficial. And it helps to burn off a lot of adipose fat, right? And increases brown fat in your body. So it's better for metabolism and energy. So yeah, I mean, you can maybe theoretically say that it has a benefit, but I don't know if there's any studies on that.
I don't know. Yeah.
Okay, great. So,
Great. Nancy said after this presentation, which we're wrapping up now, where can we find all of you and the services, resources you provide? This was wonderful, and I learned so much thanks to all of you. So if everyone can say if you have a website or a social media handle, or if you don't.
They'll put it in the chat.
Yeah. Oh, okay. Let's put it in the chat.
Yeah.
I'll put mine in. Everybody put theirs in the chat. Okay. This was really, really wonderful and informative, and such a great group of people on top of the doctors, such a great interactive group. So I am so grateful to be here. I learned so much, and I think everyone did as well.
Great.
So as a takeaways, I think we will be putting this whole discussion on our social media and on our website channels, and we'll communicate that through the meetup groups that you have registered on. So that will be there. And if you want to leave your email address on the chat also, we will kind of email directly to you whatever has been discussed here, and we'll share those details here.
So Anil, if I can just say I just put my website up, but if anyone is interested, we created a free course on functional medicine. So if you go to the website, you can just click on and get access to this free mini course that takes a little bit of a deeper dive into functional medicine. So it gives people some access, to that, to see if functional medicine is right for them.
Amazing.
Yeah, it's cool. It's free.
I love that.
Yep, no, that's great. So,
beautiful.
Yes, on behalf of ShareTech Digital, who is a sponsor of the event, as well as Natural Awakening, which is kind of the thought behind the whole event. I thank Dr. Burke, Dr. Pucci, and all the participants who took time and joined the call today. So thank you, and I hope that I'll see you guys again pretty soon. Probably we'll have our next event in about 8 weeks, which will focus, we'll announce the topic and the panel pretty soon through our social media channels and through our Natural Awakenings magazine and website. So we look forward to have you guys back again.
Dr. Burke, what is your email?
Oh, I know. I'm trying to figure out where. I don't have we don't have a patient email, if you can imagine. It all goes through the portal, which I don't know what that actual email is.
Is the website? Do you know the website?
I'll put it in the chat.
Okay, good. Wonderful.
Right.
And I think Anil said he was gonna.
Yeah, we will share the ways to kind of how to reach Dr. Pucci and Dr. Burke. We'll share those. I work with the Valley Health team, so I'll get those details and share that with the whole group over here. So we will do that. Okay.
Thank you so much, everyone.
Yes.
Thank you
Wonderful.
all.
Yeah, thank you, Dr. Burke. Thank you, Dr. Pucci, for taking time today and sharing your experience and all the information that you have. Thank you very much.
Welcome.
It was a pleasure. Thank you.
Thank you.
Bye-bye.
Bye.
This is awesome.
Awesome. Agreed.